This is Abia COVID-19 update. Abia COVID-19 update. Well, in the middle of an unsettling pandemic, the world is gradually opening up. Well, we can sing the chorus to the song Louis Armstrong, the jazz maestro, What a Wonderful World. Much cannot be said about the unknown. COVID-19 challenges us daily. Sometimes we are befuddled, other times a ray of hope. So Russia claimed that it had developed the world's first vaccine offering sustainable immunity against the coronavirus, as the pandemic marked another bleak milestone with 20 million infections globally. President Vladimir Putin said that one of his own daughters had received the inoculation. Meanwhile, the World Health Organization said it is following Russia's progress in developing a COVID-19 vaccine, but cautioned that progress in fight against the virus should not compromise on safety. But Russia has dismissed mounting international concern over the safety of its locally developed COVID-19 vaccine as absolutely groundless. It said the vaccine had been given regulatory approval after less than 2 months of testing on humans. But experts were quick to raise concerns about the speed of Russia's work, and a growing list of countries have expressed skepticism. Scientists in Germany, in France, and also Spain and US have also urged caution. So we will bring you up to speed as the event unfolds concerning Russia's vaccine. This is Abia State COVID-19 update, the 4th edition for the week. My name is Michael Oni. On this program, we highlight daily reports of the Interministerial Committee on the Control of COVID-19, as well as Dr. Okezie Ikwazu's efforts in ensuring that the state is safe from the virus. This program is running simultaneously every weekday, Mondays through Fridays, on several radio stations in the state: BCA 88.1 FM, Flow 94.9 FM, Vision Africa Radio 104.1 FM, all in Umuahia, the capital of Abia State. We're also live on Bars 89.7 FM and Real 99.1 FM, both in Aba, the commercial capital of the state. Now, on the figures and updates on coronavirus globally, the global number of deaths stands at 747,352 as at 8 a.m. today. Meanwhile, the total number of infections worldwide stands at 20.8 million, while the number of recovered cases at 13.7 million. But I will give you the development later on, and also the development in Nigeria later on. But let's quickly go straight to the discussion for today. I have the chairman of the Interministerial Committee on the Control of COVID-19 in Abia State very much in the studio with me. He's also the secretary to the state government, Barrister Chris Ezem. Good morning to you, Barrister.
Good morning.
Welcome back to the studios of Abia State COVID-19 update.
Thank you.
We have a couple of things that we should talk about, especially the progress and what is happening concerning the control of the disease, and of course checking the spread of COVID-19 in Abia State. Let's talk about the community testing. We understand that it is presently ongoing in Abia State.
Yes. That's a fact, and that's true. You will recall that 2 weeks ago, I think precisely 2 weeks now, we launched community testing further to the directive of the executive governor of the state, Dr. Okezie Ikwazu, who needed us to move down into the communities and test, and part of the process to reduce the spread, to turn the curve down, to bring down the curve. So we launched that community testing in Umuahia South local government with an impressive turnout, cutting across traditional rulers, the clergy, the civil society, the women, the men. And I particularly flagged off that launch, and after it, samples were collected right there, right on the spot, and then continually in Umuahia South, and then across the local government. I can tell you authoritatively, as at the countdown yesterday, we have done 9 local governments, and it will continue from next week, because in the last few days we had concentrated on taking samples and testing the teachers who are going back to the exit class.
Interesting.
So that is why we have a bit of the gap between on the local government testing. But I want to tell you that from Monday it will resume, going from Isukwato to then the local government and what have you. So we are 9 local governments now, and we are doing very well. and the results are impressive too. So we will continue with it. The need is to get people to come out, test them, let them know their status. But like I always say, that you test negative is not a license for you to go out there.
Okay.
And that you test positive is not a death sentence. If you test positive, we have the drugs and we will administer them to you and we will nurse you back. That you test negative is not a license for you to throw caution to the wind. You still need to be careful because you can contact it the next moment. Thank you.
All right, thank you very much, Barrister. Let's talk about the isolation centers now.
Yes.
We have 2 in Umuahia, I think 1 in Abia, the FMC, and also the Amachara. Can you bring us up to speed also what is happening at the isolation centers?
Isolation centers are doing very well. FMC is doing well. Amachara is doing well.
Amachara presently has a 99.9% survival rate, I believe.
Yes, I can tell you that because our medical personnel at both places, particularly in Amachara, are doing very well, and they are virtually on 24 hours run. And our testing centers there are operative too. We expect that come next week, the governor has just paid for 16 molecular testing equipment, which has the capacity to test about 75 in an hour at a run. 75 samples at a run. And we are going to install it in Abia IDH.
Interesting.
So hopefully by next week it should be operational.
So we're using this opportunity to call out on Abians to please come out for testing. It's very, very important. The more we test, the more we know the numbers of people that have coronavirus in the society, and of course they will be taken care of, and it is absolutely free. But let's talk about how the protocols is affecting the burials and weddings and hospitality, and also hospitality business and market, and how those protocols put in place by the Interministerial Committee have been followed by.
Before I speak on that,
yes.
you will just let me speak on that. The protocols as it affects what?
The burials.
Yes, you will agree with me now. Agree with me that the current regime, the regime we are running in respect of that, as it affects burial and weddings,
yes.
We had said for anybody who wants to, for burials, we say burials can only run first week and third week in the month.
Okay.
First and third week, Thursdays, Fridays, and Saturdays.
Okay.
And then you must apply. Prospective applicants will apply through the local government.
The transition
chairman. And then it will now come up to my office where I will give approval after vetting to be sure that it complies with the days we prescribed. And then the protocol is not more than 50 persons in the church at the burial, and then all wearing their face masks, and there must be provision for running water, sanitizers, and what have you, and social distancing. But our experience in the past, recent times, have shown that these protocols are obeyed more in the breach than in the obedience. You will find out that there are burials that are still going on as if it's business as usual, funfair, weddings with multitude as receptions, no social distancing, nothing. Accordingly, as at yesterday's meeting, we rose from yesterday's Interministerial Committee meeting, we are going to roll out the new regime now. I have instructed all transition chairmen, and they have been given a form with an undertaking. Every applicant must sign that form. You must sign it, undertaking to keep to those protocols. The pastor or the church where the burial is going to take place must endorse the form and attach your passport. We will supervise those burials without notice, and we will take photographs. Okay. Once we get you breaching the protocol, you will end up straight in the court the next month. That's
the mobile court put in place.
You will be tried summarily. Summarily. So when we set 2-3 examples, people will sit up. I can tell you clearly that people think these things are joke. We have just lost about 2 people in the last few hours.
In the last
few hours.
Here in Abia State.
Yes, right here in Abia State. In fact, as I speak to you now, I've been a very, very close friend, that runs that is in the medical circle, had been down for a few days.
Due to
And only
coronavirus.
yesterday, he was rushed to the hospital. According to the doctors, his SPO was reading 36. He was virtually struggling to breathe. He's been on oxygen, and early hours of this morning, we lost him. We lost one last night again, whose SPO was at 6. So people sit down in their homes and prescribe, do self-medication. Do you understand? Not presenting themselves very early. If this guy was presented 48 hours before now, he would have survived.
Yeah, when we have a very high survival rate at our isolation centers here in Abia
I personally supervised his being bagged and moved out of the isolation center this morning, painfully in tears, because it was a situation that would have been that shouldn't have occurred. Shouldn't have occurred for any reason. So we are preaching and we are saying this thing is real. This thing is real.
And it looks like many Abians have thrown caution to the wind.
Yes, and it's not right. And that is when you will start seeing the mortality rate will increase. Mortality rate will increase because few things are happening. One, some people don't believe there's coronavirus. Two, people move about without their face masks. If you are not wearing your face mask and somebody else, even when you are wearing yours, it is important you insist on the person speaking to you
to wear
his or her face mask, because the droplets, the spread is by droplets. The droplets from his speech, the droplets from the saliva coming out from his mouth can drop on your own dress. It can drop on your dress. It can drop on even the face mask you are wearing, and without knowing, you will touch it, and then you are touching your face. If you get home, you will remove your dress. You can pick up those droplets from there. As you touch your face, your nose, and that is it. You have contracted coronavirus. So the sermon today is: make sure anybody speaking to you is on his mask. It's not sufficient that you are wearing mask and the other man is not wearing mask. You that is wearing mask run the risk. Second point is, as soon as you feel any symptom, as soon as you feel your body system has changed, if you check it is not malaria in 2 days, immediately present yourself. The amateur is open, the isolation center is open. As you get there, they will put you on the sick bay and then run the test on you, so that you can first of all eliminate whether it is coronavirus or not. You can then know what to treat. Look at this particular case this morning. Very pathetic, very young man, stayed in his house, treating himself. Nobody raised an alarm. No family member spoke. And then when the situation got critical,
direction now, it looks like many persons are staying at home because coronavirus do have the same symptoms similar to malaria, and many persons are staying at home self-medicating. What about turning our direction to sensitizing those with patent medicine stores?
That is where we are going. I can tell you now clearly that, rising from my committee meeting yesterday, we have fixed 20th of August, which is going to be Thursday next week. We are meeting with the leadership of the patent medicine stores. We are meeting with them, the pharmacists. We are meeting with their leadership across the state and the local governments. And we are going to say, going ahead to feel that you can treat. Majority of them believe that they can treat coronavirus patients. It's a lie. It's a lie. You don't have the training. You don't even know the drugs. And then you are exposing yourself. How many of them are wearing PPE in attending to some of these people that come to their shops and say, I have malaria? And then you can see the state of the person. You don't have BP, you don't have protective distance. The young man that died this morning, does he not own a patent store? He owns. And then it is on that deception and belief that I can treat it. That's why he sat at home. And then the situation got compounded. So we want to preach to them. We want to partner with them. And we want to tell them, government is conscious of you people. Government is concerned about your safety. So our interactive session is to say to them, don't expose yourself to this risk.
All right.
It is better for you to refer any suspected patient that come to you, refer the person to amateur. We have capable hands and we have the protective garments and instruments and equipments to handle them without exposing the medical personnel.
All right, it is still Abia State COVID-19 update live on several radio stations in the state, and we have the chairman of the Interministerial Committee on COVID-19, and also he is the secretary to the state government, Barrister Chris Ezem. We take a breather now. When we return, we talk about some of the guidelines put in place for the civil service in Abia State. It is still Abia State COVID-19 update.
This is Abia COVID-19 update.
Abia COVID-19 update. So a total of 453 coronavirus cases were recorded in Nigeria yesterday. That's brought to 47,743 the total number of infections recorded in the country. No deaths were recorded also, according to the data presented by the NCDC, making the fatality to remain at 956. But in India reported another record daily rise in novel coronavirus infections, while the death toll from the COVID-19 in the country surpassed 47,000. Infections in that country grew by 66,999 from a day earlier to reach a total of near 2.4 million to date. As the country, as India, with the world's biggest caseload behind the United States and Brazil, has now reported a jump of 50,000 cases or more each day for 15 straight days. And we're trying to sensitize the people to keep staying safe so as to avoid the same scenario playing out in India. Well, we still have here the secretary to the state government, and also he's the chairman of the Interministerial Committee on COVID-19 in Abia State, Barrister Chris Ezem. Barrister, I want you to emphasize on the protocols put in place for burials, weddings, and also hospitality business, and also the markets in Abia State.
Okay, that's straight. I've told you about the burials and weddings because we are worried the way Abians are going, still operating as if behaving as if it's business as usual as it affects these two ceremonies. So that's why we've drawn the new template. You have to sign that undertaking, and once you bridge it, I can assure you, with the law enforcement agents have been enlisted, you are heading straight to the courtroom, and the applicable sentence will be meted on you. So we are not compromising that. That's going to be the new regime, and face masks remains compulsory, because that's the first line of protection everybody needs. Like I just told you now, somebody speaking to you without face masks is you that is even wearing face masks, you're at risk. So you must insist. So we want a situation where you are going to the market to buy something. You should be able to tell the woman selling to you that be on your face mask. The woman who is selling to you and should be able to tell you buying, be on your face mask, so that if both of us are protected, then community spread will be reduced. So we are going to insist on that. And then for the cinemas, the clubs is a no-go area.
Not
clubs
yet.
Clubs cannot operate, cinemas cannot operate. No, because we are going to be exposing Abians.
What about relaxation centers? There are some relaxation sports in the evening that you see opening, and people sit down to drink one or two bottles.
It is still wrong. It is wrong, because even the federal government has not lifted ban all those things. So we still maintain our close the lockdown order on those activities. So that's where we stand. And then going forward to, we are enlisting the security agents in respect of the enforcement of this new protocol regime, and we are not going to take it lightly, because we know the experiences we are going through at the isolation centers, and then people are behaving as if we don't have coronavirus, but the truth is it is here with us, and we are not being careful, and people are taking laws into their hands with respect to treating themselves. You can see the two new cases I just told you now, and they are very, very avoidable, and you will continue to see more of that if we don't take precautions.
Interesting. Now let's talk about the sensitization.
Yes,
the COVID-19 sensitization launch.
We are going to launch COVID-19 sensitization in the 17 local governments, and then we are fixed. What we want to do is we want to get together the clergy, the market association, the transport union, the women leader, the president generals of the community, and then civil society and what have you. We want to bring them, the traditional institution, bring them together. The launch will take place on the 19th, being Wednesday, and Abia South Local Government Town Hall will be our arrival point. And what we're going to do is to emphasize the need to carry this message.
So we're taking it down to the hinterlands now.
Yes, yeah. So it will, I'll flag off the launch there, and it will go simultaneously in the 17 local government. So they need to take this message down the communities, down to the villages, down to the world level. Because if we don't do that, if we don't get to the point where I will not buy something from your shop except I find you with your face mask, and I find a sanitizer or hand wash in your, then this message will not be. So we need to take this sermon. The man preaching in the church every Sunday needs to find 5 minutes to speak to his congregation on the need to maintain this protocol. So it should become, we should get the buy-in on everybody. The bystander on the road, the man on the streets, the man in the village, as you are moving, as you are walking. I mean, for example, this morning, I was in the isolation center. I was supervising the movement of my friend to the morgue, and I saw some students who are midwifery student nurses going to the class on their face mask. And I chased all of them away, and I said, you have to be on your face mask. You can walk past me. And I mean, and that's how it should be. So anywhere you go, including you, anywhere you are, preach it. Insist. If you pass a young man on the road, say, young man, wear your face mask. It's in your own interest. I mean, so this is what we want to start doing.
We have less than a minute. I would like you to talk about the civil service now. I understand there was a time where the government asked those at a particular cadre not to resume work. What is the situation right now?
Yes, rising from our meeting yesterday, we are going to start. What we want to do now is to say, beginning from next week, that from level 12 upwards, yes, we'll have to resume work, and then we'll have workers to go on Monday to Friday. We can't continue to shut down the civil service partially. So for now, we'll read out the new regime and now say level 12 upwards will start working from Mondays to Friday, no longer alternate days. So that release will be done any moment from now.
I want to really appreciate your time on the program this morning, Barrister Chris Ezem. Thank you very much, and I hope you're also staying safe as you're trying as much as possible to ensure that we're staying safe and we beat coronavirus in Abia State. Thank you very much.
Thank you.
All right, that's it this morning. Ensure that you keep staying safe. Coronavirus is real, very, very real. Many thanks to the partner radio stations, BCA FM, Flow FM, Vision Africa Radio, Buzz FM, and Real FM. The program returns tomorrow. It will be the last edition for the week. My name is Michael Oni.
This is Abia COVID-19 update.
Abia COVID-19 update.